Welcome to University Transplant Center's Acute Care Unit at University Hospital. The purpose of this video is to provide you and your family an idea of what to expect in the first 24 hours of your transplant experience. A nurse will be stopping by to prepare you for surgery. Specialists, including anesthesia, surgeons, and other transplant team members, will also be by to review your medical history as they prepare a plan of care designed around your specific needs. Do not eat or drink anything unless the transplant medical team has allowed you to do so. Do not take any of your home medications without the permission of the transplant staff. Do not unpack any belongings in this room. While you wait, your transplant team is working behind the scenes to prepare the operating room, awaiting the arrival of the organ, if from a deceased donor, and examining the organ to be transplanted. Please be patient during this time. In some cases, the organ is found to be unsuitable for transplant after you have arrived. If this happens, you will be notified immediately and discharged from the hospital. While this is disappointing, our promise to you is that we will use an organ that gives you the best opportunity for a phenomenal outcome. Your surgery will be performed on the second floor. You will be escorted to the operating room holding area on a stretcher with your family at hand. Doctors will give you medicine through an IV to make you fall into a deep sleep so you won't feel anything during surgery. The length of time a surgery takes varies according to the organ being transplanted. Your surgeon will be the best person to provide you with an estimated time frame you will be in surgery. After your transplant, the surgeon will let your family know the surgery is over. They will be directed to the 9th floor intensive care unit family waiting area. The ICU staff will need at least 1 hour to get you settled in. There will be advanced equipment at your bedside for monitoring and support. This is normal after any large surgery. The ICU nursing staff will look for your family when you are ready for visitors. Once your family arrives to your room, we encourage them to talk to you even though you may not remember much. Your family members can hold your hand or touch you as long as they do not disturb the equipment or monitoring devices. The transplant staff will be available to answer their questions. While we welcome family members at the bedside, visiting times and the number of visitors are based on your condition and needs. Because you are going to have your body's protective system, called the immune system, suppressed after transplant, we do not want anyone at your bedside who is sick. If you are stable, family members are encouraged to go home or rest at a local hotel after they have seen you. We will provide your family with a phone number for the ICU. They may call at any time for updates. When you first wake up from surgery, you may still feel the effects of anesthesia and heavy sedation. You may be confused about where you are and have questions about some of the strange sensations from the monitoring equipment attached to you. While you are sleeping, several tubes will be put into place to help with your recovery. A small tube called a Foley catheter will be inserted to drain urine as it comes into your bladder. Tubes will also be coming from the location of your surgery to drain fluid around your new organ. Most patients will have a respirator or ventilator machine to help with breathing. While this tube is in place, you will not be able to speak, but we will have other ways of communicating with you through hand signals or communication boards. Pain control is essential to your recovery. Pain can prevent you from taking deep breaths or wanting to get out of bed. This can lead to complications after your surgery. You will be given pain medications through your IV until you're able to take medications by mouth. Every patient experiences pain differently. We will ask you to rate your pain on a scale of 1 to 10, 1 being hardly any pain and 10 being the worst pain you have ever experienced. This will allow the nursing staff to treat your pain and assess the effectiveness of the treatment. Nurses will also encourage you to do coughing and breathing exercises to clear fluid from your lungs to help prevent complications or respiratory infections such as pneumonia. Putting food into your stomach right after surgery can make you feel sick, so we will go very slowly in this area. Instead of eating, you'll get fluids and nutrients through an IV. You will start slowly with ice chips and sips of water and increase your food intake as your bowels show signs of waking up. Medications will be available to control nausea. Your family will be directly involved in your care. They will be invited to participate in getting you up and moving. Your family will also be expected to participate in your discharge education and planning. Your transplant education starts now and will continue throughout your stay with us. The patient educator will provide all the necessary resources to give you the best possible opportunity for a safe and uneventful recovery after you go home. Again, welcome to the University Transplant Center. The entire team is here to make your transplant journey the start of many years with a high-quality post-transplant life.